Hello there! Welcome to my show, COVID-19 Update by Heerak for July 21st, 2020. Today is Happy National Junk Food Day. Yeah, you know how much I like junk food. um, yeah, so I hope you had some junk food today, but don't have too much. I am, you know, I am in the master's program at Georgetown University for clinical nurse leaders, so I should encourage you to eat junk food, obviously. So, but today is a national junk food day, so you have an excuse to eat junk food. So yeah. Anyway, yeah, junk food tastes good, but it can damage your body. So, especially if you're not married, you probably want to stay away from junk food, you know, because you need your figure, Being thin is half the battle of being beautiful, yeah. Um, yeah, as I said, yeah, we're going to go toward that. We're going to have a lot of death in America from COVID-19. We had 1,335 deaths yesterday, in 24 hours. That's going to only go up. Um, I'm Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District. And I am predicting that there will be like 10,000 Americans who die per day sometime in the summer. Obviously, I'm hoping that I'll be wrong. I don't want Americans to die. Um, but unfortunately, I think it's true just because we have all these cases and hospitals are reporting that hospitals are running out of ICU beds, running out of nurses. Like Florida's like asking for more nurses. I mean, yeah. And this is only July. This is like the chill time during the year, like summer season. Wait until winter comes when it's dark and dreary, like outside, especially in California, there's gonna be a lot of rain. But yeah, like in Arizona and Georgia, it's gonna be darker. Obviously, Ohio is seeing a sharp incline. You're gonna obviously have snow there. Pennsylvania has like over 1,000 cases per day. Ohio has over 1,000 cases per day. Virginia has over 1,000 cases per day. Yeah, I mean, all these states are headed toward that because this is the summer season when things are nice and warm. Like in Virginia, it's like 95, 100 degrees. And we have like 1,000 new cases of COVID now. Can you imagine what it's going to be like during winter time, during flu season? I mean, you should expect like 3, 4, 5,000 cases per day in Virginia. And that's even without any students going to school, you know. Um, yeah, I mean, my position. If we open up schools, that's going to be worse for the economy because if schools are closed uh, and the COVID-19 is not spreading aggressively, you could have some businesses open. Like yesterday, I went to get my eyes checked up. And they schedule you, and so you go in, get the temperature check, get the vision test, and come out, or pick out your glasses or whatever. I order my glasses online, but so business can stay open as long as you maintain like relatively low cases. But let's say schools open in Arlington, Alexandria, Falls Church, and Fairfax County, and the cases spike to like 5,000 per day. Everything will be shut down. Businesses will be shut down. So, you know how some people are arguing, we need to keep the schools open in order to open businesses? I would argue that that's the wrong way to argue. I would actually say if you want to keep businesses open, keep the colleges closed, keep the schools closed. Because you could, as long as you can keep a low level of infection, you could have businesses open, with strict isolation protocol. Well, let's say you're having 5 or 10,000 cases per day. You're not going to be able to keep the businesses open. You have to shut down. So you should anticipate like California shutting down, Texas shutting down, Florida shutting down with their 10,000 cases per day. And they used to have cases like under 1,000 or around, it's just like Virginia. So I would argue that people who've argued that you need to open schools or open colleges in order to have the parents work, I argue that that's the wrong way to argue things. What I would argue is this. This is Heerak Christian Kim, independent candidate for U.S. Congress, solution for how we solve this unemployment problem or problem of shutting down businesses. I would argue keep the schools closed, do an online learning, and close the college campuses, do 100% online college. That would solve a problem for like 20% of our nation's population, where the college students can look after their younger brothers and younger sisters. So let's say Georgetown University closed, then Georgetown University students can look after their elementary, middle school, high school kids, younger brothers and sisters. So all of them can learn at home. And you're giving responsibility to your college-age children to look after or babysit their younger brothers and sisters. So they're probably going to be more occupied. You're giving them responsibility. That way, you could keep the colleges closed, high school, middle school, elementary schools closed, but that frees up parents who have to go and work, right? As long as the colleges are closed, you have babysitters at home. You could babysit their younger brother, younger sisters, right? And I would actually argue, instead of trying to send the parents to work at a company, we need to shift the model of learning and model of working. Because WHO, World Health Organization, and Center for Disease Control, National Institute of Allergies and Infectious Diseases, where Dr. Fauci is the director, they're all saying that COVID-19 is going to last a long time. Many experts say this could last forever, like HIV virus or hepatitis C virus. And we just don't know whether they're right or wrong, but there is a possibility this could last forever, which means we need to shift our economy model or we're not going to survive. Because it's a simple principle in science. You adapt to your new environment or you die, right? And our new environment is COVID-19. Every time we open up, same thing's going to happen, spikes. Because these are viruses, right? So until we have a vaccine that actually proves to work, we can't gamble on life, right? Until we have vaccine that actually is proven to work without side effects that kill you, we need to keep everything kind of shut down. I mean, obviously, we want to open up businesses as much as we can. And that's why Heerak Christian Kim, independent candidate for U.S. Congress, is offering the solution to help America survive economically as well as socially and in terms of saving lives. We need to restructure American society along the nuclear family unit, meaning we need to keep elementary, middle school, high school, college students at home, doing 100% online learning, right? And colleges can still make money because you have these students paying tuition. And because now the students are at home and not on campus, you can reduce some of the excess workforce in your college to reduce costs, right? So yes, you're not making extra money from having students living in the dorms, paying rent for the dorms, or buying food. But now you can reduce the workforce in your college to reduce how much money you're paying to your labor. Because even we have to shift the learning model anyway. So there's a high likelihood that Schools have to be online 100% for the whole school year from 2020 to 2021. And if no vaccine is developed that can protect you, then we may have to keep colleges closed from 2021 to 2022 school year. I mean, just in order to save lives, we may have to do that. Um, Harvard School of Public Policy, Harvard Chan School of Public Policy, they argued in March that social distancing will be mandatorily required to survive COVID until 2022. I mean, they've said this already in March because by healthcare principles, vaccines that are viable are not going to be developed before 2 years. I mean, you could try to rush it, but you need to try and test the people, and people's bodies have to be examined over months. So any vaccine that is developed earlier than 2 years is not trustworthy, and it can have serious side effects. I mean, not working is the best case scenario, uh, but I mean, obviously, working is the best case scenario. But if it doesn't work, not killing anybody and just being like a placebo is the best case scenario. But there could be adverse reaction, interactions that scientists do not anticipate, and massive numbers of people die from the vaccine itself. That is possible. Um, and so, yeah, we want to be very careful that we don't end up killing people. Like the cure is not worse than the disease, you know? We don't want the vaccine to be problematic to the extent, like, um, that it attacks itself. You know, you know, Oxford vaccines show that there's an immune response, but sometimes immune response can go grossly wrong, as scientists can tell you, and your T cells can start attacking in your own body. You could die from them. There are diseases like that. So one of the worries about T cell mobilization is autoimmune disease, meaning the, the vaccine could trigger an event in your body where your T cells start killing your own cells. That is a danger that has to be watched out for whenever you're activating T cells artificially. Can you control it? Is it just going to be activated to the extent that it kills COVID-19, or will it go further and start killing your own cells? In which case, a perfectly healthy person who gets this vaccine could die because of the vaccine. You see what I'm saying? That's a possibility, and all the scientists will tell you that's true. Obviously, ideally, vaccine doesn't do that. But I mean, how do you know it's not going to do that? You have to study it over a length of time. So if you just administer vaccine because it's creating T cells that kill COVID, or it looks like it's killing COVID, and you don't study it over months and months and months, you administer the vaccine to perfectly healthy people, and then let's say, how about 10 months later, the immune response keeps going and ongoing and ongoing, and then it starts killing your own cells, and you die in 12 months. So we have like millions of healthy people dying in 12 months from the vaccine. Would you want that kind of scenario? Because that could happen. So it's always good to be careful, because right now people are trying to develop vaccines so you could have, quote, normal life. But I think that is the wrong way to see it. It would be great to have vaccine, but you should not count on a vaccine that's safe before 2 years. I personally will not take a vaccine that's developed by January, because I don't trust it. What if you get the vaccine and then you die 1 year later from that vaccine? Right? I'd rather not get the vaccine and see people and see what happens to them. And if they don't die in a year, then I may take it. But you don't know what's going to happen, right? So So we know that you won't get COVID-19 if you stay home, right? And you don't socially isolate, minimize interactions. That's the safest way. You're not putting anything into your body like a vaccine that's untested, um, or minimally tested, right? So you could stay away from COVID by uh, by practicing safeguards that are not invasive. It doesn't invade your body, and that's kind of the safe way. Because right now we're pushing to develop a vaccine because we want to go back to the model that we had before COVID, with everybody working in their workplace, everybody studying in their school. But I'm saying that's not the way to go. I'm saying let the vaccine develop it and test it carefully so we have a vaccine that actually works and doesn't kill people. So that has to be done, obviously. But while that's being done, I, Heerak Christian Kim, independent candidate for U.S. Congress of Virginia's 8th District, anticipate failure of vaccine for the next 50 years for COVID. I don't see it developing. Because, we've tried to develop vaccine for HIV virus. We failed for like last 50 years. We tried to develop vaccine for hepatitis C virus. We failed for like 50 years. So why do you think we're going to succeed with COVID-19? Where people say it's much more complex. Obviously it's not a 365 days a year flu virus. So it doesn't behave like a flu virus. So Dr. Fauci is saying, like, even if you have COVID-19, you can get it again, because the antibodies that develop are just temporary. A lot of scientists say that. And so, I think the best way to go is to develop our society to accommodate COVID-19, our new environment. And so sooner we do it, the better, I would argue, because it's going to take some time to get adjusted to it. So I say just start in the fall semester 2020. Have 100% of the schools meet online, and you could perfect the system of pedagogy and teaching. Obviously, teachers can teach at home, safe, and so they don't have to lose their jobs. Students can learn at home. So learning goes on. It's just a matter of perfecting the education pedagogy, or how the education is delivered. So we can perfect it better if we start now, right? Instead of like going to school and then it's shut down again in October. Then you're going to have this cycle and instability in the education system, which is not going to help anybody. So if you start by saying we're going to have 100% online learning, then all the teachers have buy-in to that. All the students and parents have a buy-in to that. Now, all the educators and educational researchers who try to develop platforms and education methodologies and delivery systems and teaching methodologies, research to accommodate the new platform, which is teaching online at home. That way we could perfect it more readily and faster with maximum efficiency. Instead of going to school and then having to shut down, then the whole academic year is lost, right? Because everybody's flustered, people have died, nobody's going to learn anything. It's about setting the tone for the whole year academically, right? If you set the tone by saying, we are going to have 100% online learning, we're going to make the best of it, we're going to develop various programs to accommodate this new reality, then it settles the students, it settles the parents, it settles the professors, settles the teachers, administrators, You do have to cut down on some staff, but not many really, because you still need all the admissions officers, financial aid officers. They'll just communicate via Zoom or on the phone, right? So they're having office hours, but it's just via Zoom or phone. So none of the key essential workers will lose their job. Professors will not, administrators will not, because they still have to do their administrative duties, but they have to adapt to the new reality. I think that's the safest way to go. So obviously you're going to minimize death to zero on campus if you meet online. and all the essential personnel, administrators, professors, you know, staff that's academically tied or support system tied to academics, all of them will continue to have their job. They just have to be adaptive to the new reality. That provides the greatest stability for the college, socially, emotionally. The social emotional learning is important. You have to create a social emotional environment or students will not learn. Professors cannot teach effectively. Social emotional learning, there's a lot of research on it. I would encourage you to read up on it. If you destabilize your college by bringing college students to campus and then like 2 months later, because 15 students have died from COVID and send them back, you're destroying them emotionally. They're not going to be in a social emotional mode to learn effectively if they had like 15 or 20 students die, right? Um, and then how are you going to, I mean, people are going to suffer PTSD, post-traumatic stress disease. So like the problem that I see with Georgetown right now, they're planning to bring all the freshmen, first year students back. And these are students who've never lived apart from home, right? From 0 to 18-year-old, they have lived at home with mom and dad or dad, you know, or grandparents or whatever. And they've lived in a fairly sheltered environment. You bring them to Washington, D.C., it's a completely different location. They've never lived apart from their home, most of them. And you're gonna, you know, it's difficult to be a freshman even when there is no pandemic. But if you bring freshmen to campus when there's a pandemic, I mean, you're setting them up for trauma. I mean, literally, you're setting them up for psychological damage and mental illness. I mean, what I foresee if Georgetown brings first year students to campus, I mean, first year students get homesick. I don't know too many first year students who didn't get homesick in the first 2 months. So even when there's no problem socially, uh, freshman students get homesick. You know, they have socialization problems in the first 2 months, some people for a whole year. So you have to deal with all that even when there's no COVID. Now, you bring first year students from all over America to Georgetown, put them in dormitories, uh, and put them one person to a room, it's more isolating, it's more lonely. Like if you have a roommate, you have a ready friend. So even if you're not really a person good at making friends, you have a ready friend. Because there are a lot of loners out there. But if you don't put people with their roommates, most of them may not even have any friends. So how are you going to help them develop friendships with people who are complete strangers, right? So you're looking at a social emotional trauma of first year students from number one, being homesick, number two, from not being able to develop friendships. At least if you put people in roommates, they're forced to be friends functionally, but they're one person to a room, they're going to be single person to a room. They're going to be lonely, right? And because of the social distancing regulations, they can't mingle socially. So you're going to probably have some people commit suicide in their dorms. I mean, I think you should anticipate at least 10 to 15 suicides in the first year among the first year students at Georgetown because of loneliness, because of PTSD, you know, psychological wound that's going to develop from loneliness, you know, or fear of COVID-19. At least when they're home, they have their mommy and daddy to kind of help them and protect them and, you know, shelter them. But now they're going to be alone in their dormitory room by themselves, isolated from anything they are used to, completely foreign environment. You're going to have students jumping off the buildings, killing themselves. You know, you're going to have a lot of mess. So, yeah, so this is a problem of bringing students, right? You're talking about 18-year-olds, you're going to bring them out of their shelter, their comfort, safety zone, and put them in unsafe zones with COVID being unsafe, but also social emotional threats that exist that can adequately be managed because of COVID-19, right? So I'm saying save yourself a lot of heartache, trouble, liability, lawsuits from parents. Like, if 15 people commit suicide first year, you're going to be sued. How are you going to prove that you were negligent in taking care of these first year students? How are you going to prove that in the court of law? The prosecution will argue you didn't have to bring any of the students onto campus. You could have just had online learning. Why didn't you do that? And how are you going to respond? You knew the threats of COVID-19. You knew the threats of socialization. You knew the psychological threats because you have a psychological center. You have a medical school. So knowing all these threats to the psyche, social isolation issues, inadequate staffing to meet the needs of the students, especially during the pandemic, can you imagine all the lawsuits you're going to have? You're going to lose every single one. Because there are universities that learn 100% online. So the prosecution can say, well, 50 universities decided to meet online 100% exclusively and to close the campus down because they wanted to save the children's lives. How come Georgetown brought the students on campus? And it was negligent because you didn't have enough people to take care of the students in this difficult time. You see what I'm saying? You're setting yourself up for multiple lawsuits. But lawsuits are not the most important thing. Human life is. You may end up traumatizing 100% of the undergraduates, first-year students. We're talking about PTSD, lifelong trauma. I mean, how are you going to live with yourself as administrators, provost of Georgetown, vice president at Georgetown, knowing that you made the decision to open up campus that causated PTSD for like nearly 100% of the first-year students in the first year? How are you going to live with yourself the rest of your life? So that's why Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District, that's who I am. I'm recommending you transition institutions and society to adapt to the COVID-19 reality, because we saw what happened when we tried to open up. COVID spread like wildfire, and this is going to happen forever until we have a vaccine or a cure. Well, even if you have cure, if you get a vaccine, what happens? So we need to start adapting just in case we don't have a vaccine for the next 10 years, because that's a real possibility. The real possibility, according to science, is you will not have a vaccine for the next 10, 20 years. This thing will be forever, meaning it's like HIV virus or hepatitis C virus. It's not going to go away. Number three, every time you open up, there's going to be a flare-up, similar kind of flare-up with flare-up of death as well. It destabilizes society, right? You keep trying to open up, it's going to destabilize society every time you try to open up. So if you try to open up every 2-3 months during a year, you're destabilizing your city, town, state, country for 4 or 5 times throughout the year. How are you going to have a stable economy with such destabilization? So what Heerak Christian Kim, independent candidate for U.S. Congress, who's also Leonardo da Vinci of 21st century, because of all my expertise, is recommending that we go towards stabilization of society and individuals and families from nuclear unit all the way up to the national unit. That is a smart way to go, right? So if we transition to 100% online learning at Arlington County Public Schools, Alexandria City Public Schools, Falls Church City Public Schools, Fairfax County Public Schools, then all the teachers will feel safe because they're going to be at home, right? And you're not going to have any teachers dying from school. I mean, they may get COVID from shopping center, but they're not going to get COVID from school. So school kind of still continues to remain as a positive image or a symbol for community, in the sense that it's a place of learning, not a place of death. How are you going to rest yourself from the image of Fairfax County Public Schools being a place of death after hundreds of students die? You can never recover from that. That's a permanent trauma for Fairfax County. Why would you want to put the community at that kind of risk? Doesn't make sense. So So Heerak Christian Kim, as you know, I've been trained as a clinical nurse leader at Georgetown University. Uh, and Georgetown University is a Catholic university that emphasizes cura personalis, treatment of the whole person. So I see everything in a holistic way. I'm not just looking at you not getting COVID. I'm looking at you not being traumatized psychologically, because psychological pain can be more painful than physical pain, right? So I'm trying to save you from psychological pain that will destroy the quality of your life, your pursuit of happiness in life, right? And that's what I want to do for first year students at Georgetown University undergraduates as well. Like, what possible benefit can you gain from bringing first year students from all over the country, sticking them in isolation, right? We're talking about isolation here. It's like punishment. You're putting them in individual rooms and making them not associate, right? You go into your room, you not talk to other people, because that's how they get COVID, right? So you're putting them in social isolation apart from their family, right? So at least if they're learning at home, they see their mom and dad every day, their brothers and sisters or their friends. They're not socially isolated. So I say go towards social stability, because that's what America needs, social stability. We don't need any more social destabilization, right? We need social stability. So I recommend we focus on the nuclear family unit, contain the COVID-19 through isolating the nuclear family unit as an entity, so that people within the nuclear family unit can be their own socialization, social emotional support network, right? I think that's the direction we must go. In order for America to maintain our economic power, we need to minimize social instability. Because as any economist will tell you, social instability is the biggest threat to economic progress, to wealth creation as a society. So we need to minimize threat to social stability. So that's what I would recommend. Obviously, you do what you want. I am the Leonardo da Vinci of 21st century. So if you listen to me, all will be well. But if you don't listen to me and go after directions or instructions of lesser mortals with lesser mental capacities than that's most of the world, then you will suffer the consequence of miscalculation. You see what I'm saying? So do not try to go back to the old country. I'm an immigrant. I don't intend to go back to South Korea. So I had to make do and survive in America, right? And that's why you have to think of yourselves. Like, you have left the old country behind. That's like 2019 United States. You left the old country behind. Now you're in a new country. 2020 COVID-19 United States. You have to adapt to the new country. You can't go back. That's the mentality you have to survive COVID as a nation. You cannot survive COVID as a nation trying to go back to the old country, right? You have to survive in COVID America. So, President Trump, I'm glad that you are coming around to my position. Today you said Americans should wear a mask. I think that's a great thing. And I see eye to eye. I don't believe we should have a national mandate, because we're not a fascist dictatorship. We're not a communist, totalitarian, socialist, Marxist state. We should require everybody to wear a mask everywhere. But as I said, businesses have the right to require their customers wear a mask if they're going to go inside their private building. So business is private space. So I encourage all the businesses to mandate that if you want to. That's your freedom. But I don't think we should mandate that as a national law. We need less government, not more government. And Republicans are right. We don't need more government. Citizens can handle this. Businesses can handle this. We don't need any mask mandates, right? Businesses can mandate mask requirements for their own business on their own. Like if you go to Giant, wear a mask, Giant can say. You go to Walmart, wear a mask. They have the right to say that, right? And you have the freedom not to shop there if you don't want to. You can do what you want. But we need a free society where people can, they don't feel like a slave. mask mandates make people into slaves. We don't need that. So I oppose Democratic governors, Joe Biden, who want to make you into slaves, require you to wear mask everywhere. No, we don't need that. We need America where you're free. You're not a slave. So so join me in trading on America that is a better America, a free America, where you are a free person, that you're not a slave. So vote for Heerak Christian Kim for U.S. Congress in Brazil's 8th District on November 3rd, 2020. And so I believe that when you stabilize and if you move the concept of workspace from a building to each family home, we can continue to progress economically without any problem. Because remember, in the olden days, you had to go into your workplace because all the work was in your workplace, right? But now we have a computerized system. We have an internet system. You could do all the work you did from 9 to 5 in your workplace, in your home. As long as you have the software, data entry you could do at home. 90% or more of the white collar workers can work at their home. And that's what we need to do. We don't need to confine people to a business building where they have to interact with people and get COVID-19 and die. That is worse for the company. So at least for accounting firms, lawyer firms, consulting firms, you can all do everything that you do. Or, now you can't do everything you do, but you have to adapt to the new environment, and you can. And that's why you should work toward, because you need to assume this COVID-19 is forever. You need to assume that there's going to be no virus for the next 50 years. Obviously, if there's a virus, that's a great thing, but you cannot make a business plan on maybe this will happen. You can't make a business plan that's going to work on a hope. Have you, if you've been to any kind of business course programs, you calculate based on data, right? What's the revenue, right? What are the expenses? And then you calculate things based on fact. You don't say, oh, if there's a virus, vaccine, you can't make a business plan like that. You cannot make a short-term business plan. You cannot make a long-term business plan. You can abandon it. You have left your old country, which is 2019 America, and now you're in a new country, which is 2020 COVID America. We have to adjust to COVID-19. Don't think about going back. You're not going to go back, okay? You're not going to go back. There's less than 1% chance that you could go back to 2019 America. Less than 1% chance, right? And there's a over 80% chance that this COVID-19 is permanent for the next 50 years without a vaccine. I would say there's more than 80% chance that's the case. I believe that no vaccine will succeed. Not a single one will succeed in the next 50 years. Because they did not develop a vaccine for HIV. They did not develop a vaccine for hepatitis C. And these were priorities for the last several decades. Priorities of all scientists and vaccine makers. They failed. So why do you think they're going to succeed with COVID? So don't bank on them, because you're going to go bankrupt. And so we need to shift our society to accommodate COVID-19, our new environment. And I encourage everybody to have a nuclear unit. We may need to go back to arranged marriage system because you obviously can't date. You could do internet dating, but everything has to change. Everything has to change to accommodate COVID-19 situation. And since we're going to meet and form our society through the nuclear unit, obviously you should get married earlier, like 18. You get married, have children while you take bachelor's courses online. You could do all the bachelor's courses online 100% now for 4 years. So you can get married when you're 18. America now is different from America 20 years ago. Like people went to college and did not get married. You don't have to do that anymore. You can get married with your high school sweetheart at 18, and both of you can work on a bachelor's degree while you're husband and wife. You know, you could use the financial aid to pay for stuff, rent, and food for your new family. You can get married. So I actually encourage your high school seniors who just graduated. If you have a high school sweetheart, get married. Move out into an apartment. Start your own family unit. Start having a baby. Don't put your life on hold because, as I said, COVID-19 is forever, most likely, and there's not going to be a vaccine for the next 50 years. Don't put your life on hold. We need to transition into the new mode of living. Um, Sooner you do that, better you will be. I know some of you are stubborn and you'll say, "Oh, things are going to be like 2019 again." No, no, you're being stubborn. You got to face your reality. We got to move forward, not backward. You're trying to move backward. And I see a lot of Republicans trying to move backward. That's not the way. You're going to lose your election in November if you keep trying to move backward because COVID's going to kill more and more people. During flu season, Heerak Christian Kim, independent candidate for U.S. Congress, is predicting that COVID-19 will kill 1 million people per month in America alone. Because there aren't enough people shutting down, unless we go to the nuclear family unit and isolate each nuclear family unit, you're going to have 1 million deaths per month during the flu season. Watch if Heerak is wrong. Heerak is right. I'm Heerak. Heerak Christian Kim, independent candidate for U.S. Congress for Virginia's 8th District. Sooner you listen to me, sooner you're going to go toward prosperity as a nation. I speak as a national leader of the United States. Obviously, I'm running for U.S. Congress. And I feel that my solutions are superior to Ted Cruz's solutions, Marco Rubio's solutions. I intend to run for Senate someday. I'm running for U.S. Congress now, but I may run for Senate. In 2000. I don't know when is Mark Warner is up for re-election this year. Who's the other one? When is he up for re-election? So if it's up for re-election in 2 years, I may run for Senate. But because I feel like Ted Cruz and Marco Rubio needs me there to give them direction. That's what I feel. I will be your guide, Ted Cruz and Marco Rubio. Do not fear, I'll be there soon. Let's see. Maybe God doesn't want me to help you. It'll be your blessing from God if I become a senator for Virginia and then go there and be your supporting guy. And Leonardo da Vinci of 21st century, you won't make the mistakes you're making now. If I'm at the Senate and I talk to you and give you some guidance and encouragement, you're obviously smart and bright individuals. You're just making a lot of mistakes in COVID-19 era. Yeah, so, as I said, I don't care if I don't get elected 2020 election. If God doesn't want to be elected, that's fine. I have other things that I need to do. As you know, I'm finishing up, clinical nurse leader program in August, and I'm planning to work full time as soon as I finish as a nurse. So if I don't get elected to U.S. Congress in November, I'll continue to work as a nurse in the hospital that I work in and save, lives there. As a U.S. Congressman, I could save 330 million American lives, but if maybe God doesn't want me to save 330 million American lives, in which case, I'm fine with that. I do what God wants me to do. I'm happy to work in a hospital saving, 2, 3, 4, 5 lives at a time. That's fine too. It's your loss as a nation. It's your loss as a House of Representatives. And the United States as a nation may collapse if the United States Congress doesn't have Heerak Christian Kim serving in the U.S. Congress as a congressman. But, countries collapse all the time throughout history. Hospitals still have to operate. People still have to eat food. People still get married when countries collapse. So it's not like, people stop marrying just because the nation collapses. People don't stop eating because the nation collapses. The United States is headed toward complete collapse as a nation. And if I get elected, Heerak Christian gets elected for U.S. Congress, you're lucky because I will save you. But if you're not lucky, if God doesn't want to bless you, then I won't be elected. That's fine with me too. I do what God wants me to do. You guys don't want me to be your leader. That's fine with me. I don't care. You know, I will serve God, my God, Jesus Christ, in whichever capacity He puts me. If He puts me in U.S. Congress, I'll do due diligence to save America. If I'm not in U.S. Congress, obviously I can't save America. you know, if I'm not in Congress, because I'm not a, I'll be working and saving a few people's lives. So in a year maybe I'll save 100 people's lives. Maybe the United States will collapse by year 2022. That's fine. I mean, there is no law that says the United States should not collapse. I mean, America's headed to complete and total collapse, as you know. And if you don't want the brain and expertise of Heerak Christian Kim, you're on the reach of 21st century. It comes around every 500 years to rescue the nation. Well, that's fine. I mean, hey, I'm not going to lose sleep over it. I'm happy. My value is in the fact that I'm a child of Jesus Christ. I'm a child of God. That's all that I need to be happy in life. I don't need anything else. Yeah, I mean, you vote for me if you want America safe. Don't vote for me if you don't want America safe. I mean, it's your free choice. Yeah. Um, yeah. Anyway, the ladies there are from Germany that I met in Heidelberg. Yeah, I love beautiful women. I love German women the best. Blonde hair, blue eyes, absolutely beautiful German women. I wish I were in Germany now. I love German women. So when I was in Heidelberg, I became friends with a lot of beautiful German women. I dated some of them. And here are some of the women that you see that I really liked. Spent time with. Yeah, so anyway, I share my life with you. I'm full transparency. Vote for me if you agree with me. Don't vote for me if you disagree with me. You're free to do what you want. I'm not asking you to be a slave. I'm asking you to do what you want. I tell you exactly what I support. I tell you exactly what I'm going to do. If you like it, vote for me. Don't like it, don't vote for me. Don't get all like uptight about it. Yeah. Now, I'll give you top 5, and it's changed. I don't know if I should collab and say congratulations, California, because now it's number 1. It's number one for COVID-19 cases in America. As you can see, it's 409,305 cases. Their death rate is at 2% because the second thing only started like 3 weeks ago. So because people are going to the hospital, they're not dying. The hospital prolongs your life, right? So, you still have to wait a few more weeks, 2-3 weeks to see death rate, spike up. I mean, it's going up already. It's like 100 to 200, and it's going to eventually go to like 1,000 per day. So it's going to take time because a lot of people are going to the hospital, and the hospital saves your life with their ventilators and nurses taking care of you. Some people may not die because of that, because you went to the hospital. You know what I'm saying? That's what hospital is for. I'm going to be working in a hospital in August, right? I interviewed, and I have 3 more interviews. I have an interview tomorrow. I have an interview on Thursday. I have an interview on Friday. And the lucky hospital will get to hire me. And the lucky patients will get to see me treat them. So, I'm not stressed. I go where God wants me to go. I go where God wants me to go. If God doesn't want to save you, that's fine. I only save whom God wants me to save, That's where I go to treat you, right? If God doesn't send me to a certain place, then, tough luck. So anywhere who's lucky enough to get me as a nurse in August, you're lucky. Obviously, I worked very hard as a nurse, and I plan to get elected in November to U.S. Congress in the U.S. 8th District and get sworn in January. So I'll be working as a nurse from now to basically December. And then obviously I can save the United States of America as a congressman starting January. If God loves you, I don't know. I don't know if God loves you or not. But we'll see. If I get elected for U.S. Congress, I could see maybe God loves you, you know. But if I'm not, the nation's going to be completely collapsing. My prediction is this nation will be collapsing within the next 3 years because COVID's not going to stop. Look at the way people are acting. All these Republican senators bending their knees to defund police. It's embarrassing. If I were in Congress, I would have stopped them before they started to bend their knee. Yeah, I would have stopped every single one of them. I would have gone to Ted Cruz, I would have gone to Marco Rubio. I said, don't bend your knee. You have some dignity, man. You know, that's what I was saying. Um, but anyway, I wasn't there, unfortunately, to stop Marco and Ted. So, that's why you need to vote for me. You know, this has to be voice of reason in the Washington swamp. Anyhow, yeah, so number two is New York. They were number one. They have 408,118 cases, and their death rate was at 8%. So then 32,520. I believe that California will get there. So you should see about 30,000 deaths in California in the next 2 months. I mean, the hospitals are filling up already. So once the death starts accelerating, people are just dying left and right. Yeah, 100,000 daily. So, we haven't hit the critical mass yet. We're still climbing up. So, yeah, so I expect at least about 30,000 to die in California, the second peak. New York is going to get second peak. So I expect New York to double 32 to at least 60,000, maybe more. Because, as soon as COVID starts spreading in New York, it's going to catch on like wildfire. It's going to be like March and April. Deja vu, that's coming to New York. Florida is 369,834 cases. Their death rate is 1%. Wouldn't it be wonderful if they could maintain the death rate? 5,206 people dead with 369,834 cases. I said test more and more people just to keep the death rate low. It looks good on paper. But I don't think that the rate of 1% will be maintained because there's like 56 hospitals that have ICUs full, which means next time that people want to go to a hospital and they don't have a ventilator, they're going to die. So, yeah, so I expect the death rate to spike. It's going to be probably at the end of the second peak, we're going to probably see something closer to like New York and not Oman. It's supposed to be New Jersey. I don't know why the Oman is there. It's like a typo. I think they did an autocorrect. Don't you hate it when like your program autocorrects your what you type and you're like, how did that get there? Yeah, it's not Oman. It's New Jersey. But yeah. Texas has 351,071 cases. Their death rate is at 1%. So 4,199 have died. And not Oman, New Jersey is fifth place with 177,256 cases and 15,737 deaths because its death rate is 9%. I anticipate California, Florida, Texas to eventually go to like 8 to 9% death in the second peak. Let's see, we were counting all the spiking cases for several weeks, right? In the next several weeks, we will be counting all the spiking deaths. Yeah, that's coming. Unfortunately, but it's coming. Yeah. Yeah, yeah. So today, as you know, I'm a clinical nurse leader. I don't know what to call myself because I passed my clinical nurse leaders national certification exam last Monday. So like 8 days ago. And I'm waiting for my certificate. And as soon as I receive my certificate, I'm officially clinical nurse leader. But I guess the policy is you gotta have the certificate in hand. So I'm like in the limbo here. I was the first one in Georgetown University Clinical Nurse Leader Program, cohort class of 2020 to pass my exam. I'm hoping that everybody will pass. I'm keeping my fingers crossed for all of my board members because I love you guys, all 24 of you. So I want to do a cheer Well, pin, 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 pin. We're pinned, yay! We're pinned in May. Uh, as I said, I expect 5 to 10 of us to die by Christmas from COVID-19. There's 25 of us, so 5 to 10, that's 20 to 40% of us will die. Because PPE are going to run out, ventilators are going to run out. When people start dying at the rate of 1 million per month, a lot of nurses are going to die. So Heerak Christian Kim, independent again for U.S. Congress and Virginia's 8th District. Uh, my prediction is that 10,000 nurses minimum will die in America by Christmas. Yeah, so we're looking at massive deaths. Um, you know, yeah, I mean, only thing you could believe in life is Jesus. I know some of you believe that we could open up and not go back to normalcy. Yeah, you're putting your faith in the wrong things. You gotta put your faith in Jesus. Only Jesus saves. Only Jesus is true. Only Jesus is faithful. Your friends can betray you. Your best friend can betray you even with your life. And, when we look at all the cases when there's an adultery, often it is with like their, the best friend. That's like a typical thing. Yeah, you can't trust your best friend with your wife. Are you kidding me? Every man's a dog. You can't trust any man with a woman. I mean, if you're a woman, like a wife, make sure you have a tight leash around your husband, because all men are dogs. Doesn't matter if they're pastor, elder, or deacon. Put that leash around your husband, if you want. You gotta secure your own happiness. You can't expect to be happy the rest of your life if you let the dog roam free and start biting people. You know what they do to dogs that bite people because they're not leashed? Learn to leash your husband. Yeah, that's the way you're gonna be happy. He's gonna be happy because do dogs know that they're gonna be unhappy if they bite bite and go up, run around wreaking havoc, and then they're put down? No, they don't know they're not gonna be unhappy. They don't know. So you gotta save your dog from the dog self by putting that leash around the dog's neck. Same thing with your husband. He may think that he's happier without a leash because he doesn't know better, but he needs a leash, you know. And so you're making your husband happier and you happier. When I say leash, I'm not talking about an actual leash here. Don't buy a leash and put it on your husband physically. I'm talking in metaphoric sense about just make sure you have a tight grip on your husband. Know where he is 24 hours a day, every second of that hour. Don't let him alone with other women. These are the simple things that you should be serious about. Yeah. If you want to be happy, you gotta make your own happiness. You can't blame your husband because he cheated. If you didn't put a tight leash around him, you're at fault too. Because if you had a tight leash around him, he probably would not have cheated on you, right? You would have seen it coming and then stopped him. Because you let the dog run free. The dog went and started biting. Yeah, that's what happened. So you're partly at fault if your dog, your husband goes and cheats on you because you don't have a leash around them. You're not keeping tabs. Yeah, you need to be more hands-on with your husband. Yeah, it's work, maintaining a successful relationship. This just dropped down from heaven. Yeah. So, so today I want to talk about failure mode and effect analysis. Unlike the fishbone diagram that I talked about yesterday in my show, which is examining the causes after the damage, kind of like what we're doing now with Texas, California, Florida opening up, what went wrong. And I hope all the governors in these states are getting their team to do the fishbone diagram to study the causes that led to this failure, because all you governors are responsible for what happens in your state. You're to blame because you're the governor. Buck stops with you. Yes, it does. This is the top person in your state. So be more conscientious about your responsibilities as a leader. See how conscientious I am as a national leader running for U.S. Congress in Virginia's 8th District? You gotta be like Heerak. Be like Heerak. Be conscientious. Yeah. This is why you need me in Congress. because too many congressmen and senators are not conscientious of their responsibilities in a COVID era. Yeah. Now, unlike fishbone diagram that examines the causes after damage has been done, failure mode and effect analysis is a methodology we learn as clinical nurse leaders at Georgetown University that is meant to prevent a tragedy or crisis or problem from occurring. So this is more of like a preventative measure. So we study the problems that could happen before they happen. So this is, I always say, better because with what's happening now in Florida, Texas, and California, it's too late to do failure mode and effect analysis because damage has already been done. Only thing you can really do is like use a model like fishbone diagram to study the causes, like root cause analysis. What went wrong? So you can approach it from that vantage point. But what I'm encouraging Heerak Christian Kim for independent candidate for U.S. Congress is let's do failure mode and effect analysis for the future. What can go wrong, right? Because that's more helpful. If you can prevent the tragedy from happening, that is better than picking up the pieces after tragedy happens. Do you see what I'm saying? And so the brilliance of Heerak Christian Kim is I am able to provide you with failure mode and effect analysis based on data, both quantitative data and qualitative data, using the expertise as a clinical nurse leader who's waiting for a certificate, who's an expert of history, who's an expert of theology, who's an expert of Jewish studies, who's an expert of education. He's an expert of administration. So I offer expertise to you to prevent tragedy from occurring. So I discussed with you earlier in today's show what we must do to prevent tragedy. In a sense, I'm offering you recommendations to prevent the tragedy. And to a certain extent, it's based on my failure mode and effect analysis, right? So look at this. We have to determine the failure mode, right? What can happen if we bring first-year students to Georgetown University, isolate them in their rooms? We're putting them in a mode of isolation without enough social emotional support or right network. So we have to determine failure mode before they happen, right? And assessing severity. How severe can it be? As I said, I anticipate anywhere from like 15 to 20 first-year students committing suicide in their isolated room, depressed and homesick without mommy and daddy to give them a hug. Yeah, even if 15 to 20 people commit suicide at Georgetown, I anticipate during 2020, 2021 academic year, these are 18-year-olds who've never really lived apart from home. I mean, you should expect that kind of severity, I would argue. And given the PTSD factors that will be playing, yeah, you can't control everything. Yeah. And assigning probability number, I guess I will assign the probability of this happening at 80%, right? Right? I said there's an 80% chance that things can go horribly wrong. So I've assigned the probability number, right? 0.8, 80%, 8 out of 10. Assigning detection number, well, by the time you detect it, it's too late. Yeah. Like the beautiful woman there with beautiful body in the beach, you see it, you could detect it like within a fraction of a second. If you look and you see she's beautiful, that's detection factors right there. It's not so easy with COVID-19 because when COVID-19 infects a person, there's a incubation period and prodromal period where they are showing no signs. while they're showing those signs, they can still infect other people throughout Georgetown University. So detecting, being able to detect maybe 2% chance, 3% chance, very low. So 0.02, maybe even lower than that. Psychological damage that's occurring among 18-year-olds who are brought to Georgetown and put in isolation rooms, detection factor, I would say probably less than 1%. You're not going to be able to detect they're depressed. You're probably not going to be able to detect that they're suicidal. And that's why I predict 15 to 20 down. So I'm using failure mode and effect analysis to help Georgetown from itself, from self-destruction, by opening the campus to first-year students. That's self-destruction. And I know you're watching President Joya. You know I'm right. I know you're watching Provost and Vice President. I know all of you personally, obviously, because I've been at the meetings. And I was the Vice President of Georgetown Graduate Student Government, GradGov, from 2019 to 2020. Like, from August or actually started like in May to May. So yeah, so I know, I had discussions go on and how the operations work. And that's why you need to listen to me, because I know the inside and I know what's going on now, and you definitely have to listen to me. Yeah. A lot can go wrong, a lot. And you'll regret it if you don't listen to me, You know me, so you know I'm trustworthy. Um, yeah. And calculating risk, priority number, it's priority number one. Priority number one to close down the campus to prevent theft. Yeah. So anyway, so you see how these things work, right? In life, you can use failure mode and effect analysis for anything, for everything that's personal, like marriage. Like I took Rachel Saunders to Mayball at Jesus College, right? She's at Trinity Hall, and I talked about that in my previous episode. And when you're calculating things, asking a girl out, proposing to her, you're kind of doing everything, like failure mode and effect analysis. Right? What kind of things can go wrong when you're planning for a wedding? Like Emily Norris has a wedding planned for December. She has to do failure mode and effect analysis of whether to have the wedding. Like she has to decide whether she's going to cancel the wedding or whether she's going to continue to plan for it as if things are going to get better. And if she's going to cancel the wedding for December, is she going to move the wedding up? She has to make all these decisions based on failure mode and effect analysis. Not just Emily, who's in our cohort. Obviously, her engagement is public knowledge, but for all of you who are engaged now, some of you are saying, I will wait until COVID-19 goes away. It's not going to happen. As I said, Heerak Christian Kim predicts that there will be no vaccine for the next 50 years and that this is like forever. I think that experts have proven that that's possible or likely even. So you need to do what you need to do now based on the new world. You cannot go back to 2019 America. Accept that. I know a lot of Republicans haven't accepted yet, and it's a problem. And you will see how big of a problem it is as months and years come. You're not going back to 2019. This is a permanent condition, and that's why you're going to accept. Anything that changes, if we ever go back to 2019 America, that would be a miracle of God. And I don't anticipate God giving us this miracle because, history, I study history, right? Thousands of years of history. God does miracles sometimes, but rarely. Rarely does God do miracles. Yeah. So, yeah, I mean, yeah, I mean, our economy can collapse if you don't listen to me. We need to transition all work to be home-based. We need to isolate America according to nuclear subunits, meaning father, mother, children. I mean, you could bring your grandparents in there, so it's not totally nuclear, but you need to to have like relatives living under one roof with maximum isolation from outside contacts. That's the way we're going to survive as a nation. That's the way we're going to minimize deaths. And if you bring your grandparents to live with you, you test them to see if they don't have COVID. If they don't have COVID, bring them home to live with you. Then you have more freedom of movement. There are some jobs that where you have to work, like bus drivers cannot work at home. There are some jobs where you can't work at home, and if your grandparents are living with you, taking care of your children, then then you can drive your bus or whatever you do. You see, so we need to kind of focus our social units based on the nuclear unit. You got to maximize human resources in the current condition. And we're not going back to 2019. Yeah. And so, yeah, so that's something you need to see. I love to go back in time. I think Rachel is really pretty. If I could go back in time, maybe I would have been more serious with her. Maybe we would have gotten married. Who knows? Same with the beautiful lady underneath in the corner there. She's a Belgian. She's an expert of Hebrew and Jewish studies in Belgium. Teaches at Catholic University of Leuven. Yeah, if I could change the time, I mean, I had a date with her. That's the photo that I took when I had a date with her. And she looks like she's interested in me, right? She seems, women will not say yes to a date unless they're interested, right? So obviously she was interested. Um, if I could turn back time, yeah, maybe we'd be married. She's beautiful. Or the German girl next to her, you know, and that was in Cambridge Beer Festival in the summer. We had a great time. She's pretty. I mean, if we could go back in time, maybe I'd have done something. So what I'm saying is, yeah, there are a lot of things you want to do. Yeah, you want to go back to the past, but that's not going to happen. So what I'm saying is like 2019 America is the past. You're not going to go back to that. Sooner you accept that, you can move on. If I'm like weighed down by, oh, Rachel Saunders, I wish I did more and got married to her, I'm not going to have a happy life. I'm not going to be able to marry a beautiful woman who comes along who wants to marry me, who's a good Christian, has a beautiful body, and who's really pretty and um, yeah, remember, you notice I didn't talk about college degrees, right? The most important thing in a woman, in my opinion, is her physical beauty, because that's the most honest thing about her, right? She can't lie about how she looks because you're looking at her. That's the most honest thing about people. What you see is what you get. So, because you don't know what she really is like personality-wise. She could change her personality. You really don't know what she's thinking or feeling. You only know what she tells you, but you know what she looks like because you're looking at her. So that's the most real thing about any person. And as a man who likes to marry a girl, I want to make sure I focus on the reality, more than things that you cannot ascertain, you know. Um, so that's why when I talk about women, I want them to be Christians, right? So they need to tell me they're Christians, and I guess I have to go by their word on that because I can't see their heart. But I need a woman who's a good Christian. All Christians should be marrying Christians, right? After that, most important thing for me is their physical beauty, how she looks. If I like that, that's really important. That's my first most important thing. After that, other things are important, but because you don't marry your friends, right? You can be friends with people, you don't marry them. You marry women because you want to have sex with them. You want their body. You want to share the bed naked at nighttime. So you don't marry a woman to be friends. Do you see what I'm saying? So I'm going to put it bluntly to you because sometimes in the Christian circles, one of the biggest problem is people don't spell out facts in a way that is easily comprehensible for people, so people get confused. You're not going to be confused in my show. I'm going to tell you everything explicitly and clearly at a fifth grade level, because that's why we're trained as a clinical nurse leader program. They say you need to provide nursing education at the fifth grade level so that everybody can understand. So that's what I'm doing here. I provide education to you, because this is education, public health education to you at the fifth grade level. So everyone who watches this show, whether they're college students, PhDs, high school graduates, high school dropouts, middle school dropouts, even elementary school dropouts can understand this at the fifth grade level, because that way I could cover like nearly 100% of the population. This show is for 100% of America, not just for people with PhDs. And that's why I explain in terms that are at the fifth grade level, so everybody can understand what I'm saying. So you're very lucky, because I'm the Leonardo da Vinci of 21st century. What I learned at Georgetown, I internalize, and then I externalize to you. Right? I'm a very good communicator, and you're being communicated to, so that the message is transmitted in a way from the sender, that's me, that the receiver, that's you, can understand. Yeah. So you're very lucky that I created this show to save you and your children's lives. If you have children about to go to college, you know from this show you should not send your child to college, because most likely your child will be traumatized with PTSD in 2020 COVID America. Like, by going to college, your child will be traumatized. Your child will not be the same when she comes back or he comes back after first semester, because the child will be so traumatized. That's why I said don't send your child to college, because this is not 2019 America. This is 2020 COVID America. You need to adapt your parenting to 2020 America, and being a good parent is not sending your child to be socially isolated in a college campus, in a single room by himself or herself, to kill herself in, because she's so homesick or depressed. You don't need to do that. So I give guidance to all the parents out there not to send your children out to college. You'll regret it. Your child will be a shell of who he is or she is when your child comes back. What do you think is going to happen from now to December? You think everything will be like now? No. As Heerak Christian Kim said, 1 million people are going to die per month in America during the flu season. Don't you think your child would rather be at home with you and be able to hug you and hold your hand and cry on your shoulders? Your child needs emotional protection in a tragic scenario that's about to sweep through America during the flu season. Yeah, your child needs you. Don't send your child to college. Don't send your child off to college. You're sending your child maybe to her death. She'll kill herself. And if she doesn't, she'll be traumatized. She will not be the same person. She will lose all of a positive, bubbly personality. She will be a shell of herself. That's what PTSD people are like. She will become a PTSD victim. And there's nothing you can do once she becomes a PTSD victim to save her from her nightmares, for her depressions. Yeah. So I'm doing failure mode and effect analysis for your family, for your children. So if you're a good father or mother, you will not send your child off to college. It sounds like it's like a Japanese wailing. That's what you'd be doing if your child commits a suicide because she's so lonely or so afraid of COVID, isolated from you and your wife and your children. Your 18-year daughter, your 18-year son needs you. So don't be banishing your son or daughter to a faraway place by himself or herself. mean. It's nasty. And you'll be wailing and singing tragic songs like the guy, the Japanese man that you're hearing. I don't know Japanese, so I don't know, what they're saying. My grandmother was fluent in Japanese. My grandfather was fluent in Japanese because during the Japanese occupation of Korea, 1910 to 1945, Japanese imperialist government came, occupied Korea, and forced everybody only to study in Japanese. So all the Korean schools had to teach uh, in Japanese. They couldn't speak Korean. So my grandmother did not know how to read and write in Korean. So after the Korea was emancipated through two nuclear atom bombs dropped on Hiroshima and Nagasaki, she had to learn Korean writing and reading from scratch. They spoke at home, vernacular Korean, but she couldn't read or write Korean because they didn't teach that it was illegal to read and write in Korean. Yeah. So as you know, one of my theories is that COVID-19 may bring Chinese invasion of America, where they are going to try to colonize America. And the Korean history, we had a history where Korea was colonized by Japan for 35 years. So yeah, so all the grandmothers of my friends, they couldn't read Korean, they couldn't write Korean unless they taught themselves or went to like a community center to learn Korean after the Japanese occupation was over. So Japanese was the language that was taught in school. You had to be, that's why you wrote essays in, that's why you wrote exams in, that's why you read books in. Yeah. Um, so Japanese music like this, um, like my grandmother's generation, they all understand. Not any problem. You go to any Korean church, you find somebody who's like my grandmother's generation, they all understand this perfectly. Because for 35 years, 100% of the country was colonized by Japan. Every single school was required to only teach in Japanese. It was illegal to teach in Korean. Every subject, math, English, or math, language, history, and science, everything was taught in Japanese. Only Japanese, no Korean. Yeah, so that's what could happen to America if China comes and occupies us in our moment of weakness. That's why I'm saying we need to hunker down, strategically make our nation survivable from COVID, or we may end up becoming colonized by China or another country, like Russia, which don't have the kind of COVID problems that we have. I mean, nobody's dying in China right now. Their economy is running at full force. I mean, I wish we were like that, but we're not. We're not going to get there. In the current situation, we didn't go to zero. China did. China went to zero. 0 cases per day. So yeah, it's not going to happen here. So we need to accept the fact that it's never going to happen. We're never going to go to zero. Okay, in the foreseeable future. Um, so yeah, we need to adapt our environment. Uh, China obviously is growing in leaps and bounds in power now, and maybe they're planning to invade America in our moment of weakness. We need to hunker down. We need to stabilize our society. The only way we're going to do that is if we do 100% online education and we transition working to working at home 100%. We need to get there. Yeah, if we don't transition effectively and efficiently in a short period of time, we as a nation may not survive. And that's expert advice from an expert historian, who knows history very well. So anyway, I'm glad that you were able to join me for this show. I hope that you will, you will be able to to come to understand what you need to do to protect your children from trauma, PTSD, the COVID era, or even suicide or death, mental disease, from loneliness. Because if depression becomes serious, it becomes a disease. And that's why I'm saying bring people into the family unit. So there's so yeah, so don't send your 18-year-old children to well, they're not children anymore. They're 18, but do not send them to a totally new place with no real friends. That's kind of mean. Yeah. So yeah. So hopefully, you're learning something that can help you survive, but also to be able to have quality of life. And obviously, I'm happy to provide this public health service to you through this channel, COVID-19 Update by Heerak. So check in tomorrow for more helpful advice to help you. And I'll come up with more and more helpful and important things to help you survive COVID-19. You're very fortunate that this show exists and that this show exists for you. I will bid you adieu for now. Be well, and I hope that your family will be well too. Bye.